testing negative for, and so it's just something. And I'd say also this. You know, people ask, like, you know, I think people are confused because they're like, okay, what's going to happen next week or 2 weeks or a month or 2 months from now? And, you know, we're working in conjunction with the President's Advisory Committee, the CDC, and obviously our local governments. You know, we're really trying to follow the CDC guidance and support the 15 days to stop the spread. And I think that that's very, very important. But I think people look at it and they're like, man, you know, what can we do? Here's the good news. There is a lot you can do in just your individual lives to be able to protect yourself from acquiring the virus and from passing it on to somebody else. This is a virus that is contracted usually through respiratory droplets when somebody coughs or sneezes. So this is usually someone that you're in close contact with within a 6-foot radius. You also can get it if those droplets fall on a surface and you touch the surface and then touch your face, although most of the cases, by far, are from people who you've been in close contact with. If you look at the cases in places like Broward and Dade, you have a pretty significant percentage related to international travel, and then another significant percentage of people who you've been in close contact with, known contacts who are carrying the virus, and that close contact is what allows the transferability. So when people talk about things like social distancing, what they're basically saying is, you know, protect yourself. You know, avoid any types of crowds of people. Keep your distance if you're in public. If you stay in those comfort zones and don't go and have close contact with someone that's infected, then you are going to be protecting yourself. If you're making sure to wash your hands and not touching surfaces that may be infected, you will be doing a lot to protect yourself. And so that individual conduct is something that's very, very significant. So just know this is not a disease like the measles, where if you just happen to walk, you know, past somebody or be in the same room you may breathe in. It's not as contagious as that. It really is more of a close contact. It's still something that's contagious. They think it's more contagious than the flu. But if you just take those precautions, you're really going to help stop the spread, help protect yourself, your families, and others. Most of the cases typically are within the same household where somebody's infected. They're obviously living and eating and with their family members, and then it's contracted that way. Finally, we have a facility update. I mentioned yesterday, statewide, we're keeping track of the availability of beds. You know, one of the key things on this is obviously, you know, how fatal it is, which is very serious. We know most of the fatalities have been with people who are elderly and/or have a serious underlying medical condition, and the ones that have both, they're elderly and a significant underlying condition, you know, they're the most vulnerable for fatalities. But we also know that there's a certain percentage of people who, while they don't die, you know, are going to require hospitalization. And so the hospitalization rate is something that we're following very closely, the number of beds and the bed capacity statewide. So we're at about 18,131 available beds statewide, and we're about 1,700 ICU beds statewide. And 34% of our hospitals statewide have 50% or greater capacity right now. My agency for healthcare administration has been in communication with 6 vacant medical facilities throughout the state, which we are, you know, if we need to utilize it for the COVID-19 response effort, they're evaluating how that would work and how you would set it up. That obviously is, there's a lot of logistics involved in that. Our Department of Emergency Management also has some facilities that can be put up. All that is being said, we hope it doesn't come to that. We do have capacity, but we got to do our part to stop the spread of the virus so that we don't end up overwhelming the healthcare system. rundown of the numbers of cases. We've had 768 Florida residents test positive for COVID-19 as of this morning, 62 non-Floridians who have been in Florida recently. The number of fatalities statewide is 13. We've had close to 8,000 negative test results. In the state health department labs, there are 962 pending test results, but understand there's so many of these tests now being sent to the commercial labs. At the state, we don't have visibility on what is being sent to the labs. We get the reports on who tests positive, and we're supposed to get on who tests negative. So there's probably many more tests that have been outstanding. So you've seen a scale up in the testing capacity. We want to continue doing that because we think that that's important. Total amount of positive cases, Broward is 180 and Dade is 177. So pretty comparable. Obviously, Dade would have fewer per capita because it's a bigger county, but those cases combined with Palm Beach are close to 50% of the total infections that have been reported in the state of Florida. So we want to work hard with the folks in South Florida on the prevention and mitigation and containment efforts. And I know a lot of the folks here at the county and city level have been working tirelessly to help get this done. So I look forward to people being able to come out tomorrow, get some of these very needed tests. I want to thank the National Guard for really responding very quickly. Just 2 weeks ago, everyone was still sending it to CDC. Once we figured that out, we got the Guard to put this up very, very quickly, and they did a really, really good job doing it. I'm going to have the Lieutenant Governor come up, say a few things for the Spanish audience. Then we'll hear from Jared Moskowitz. And I also want to thank Carlos Magoya from Jackson Hospital. They are partnering with us on this, and I think that they've been a good partner. We also want to work with Jackson and Carlos to do another site in a different part of the county. Certainly as we get supplies, I'm willing to put in state resources for that because I think it's important. So it's just a matter of getting everything lined up, making sure we have enough swabs. But Carlos has been great, Jackson has been great, and they've really helped step up to help support the population here in Miami-Dade County. So with that, I'll introduce the Lieutenant Governor.
Thank you, Governor. Buenos días, muchas gracias por estar aquí con nosotros. Estamos muy entusiasmados de poder anunciar que oficialmente mañana este sitio estará.
We're wrapping up right now with Governor Ron DeSantis. You can see them right there in Miami Gardens at the Hard Rock Stadium again. This is being opened up as a testing site for first responders today. They are being able to get tested between 11 and 3 o'clock, but tomorrow is when it'll open up to the community between the hours of 9 to 5 p.m. And I do want to reiterate some of the numbers that we went over with Governor Ron DeSantis. A total as of today, 768 residents have tested positive for coronavirus. Of those, 62 are non-Florida residents. There have been 13 fatalities statewide, 8,000 negative results, 962 pending results. So again, right here at home, 180 of those positive results are in Broward County, 177 in Dade. So this is something that we're monitoring closely, but I do want to point out again, while to think about Hard Rock Stadium, the point of interest throughout the country as they was held for the Super Bowl, now it is a testing site for coronavirus. You will see some of those signs again on the highways as if you are headed out on the roadways for COVID-19 testing. Again, tomorrow, if you are showing symptoms, I just want to go over that criteria. You must be 65 or older and symptomatic or have underlying health conditions to go ahead and be tested again between the hours of 9 to 5. This stage will be going pretty quickly here. I wrote down the different steps that are happening there. People who are going in there, you must stay in your car. You must be in a vehicle. You will not be able to go and access that site if you are on foot or on a bicycle. You will go and get tested first with your temperature. Then you'll move on to registration, and the last station there will be swabs. The governor is insisting that this is a fast, quick process to make sure that you are staying home as much as possible to get you in and out of that testing. Test results will take about 3 to 4 days. So they ask you to just stay inside while you're waiting for those results. And they will be testing twice daily at a lab in Miramar. So this is the second federally funded supported site in Florida. The first was in Orange County. Of course, we'll be keeping you up to date for the latest happening on the coronavirus. You can head over to the NBC6 app or even our website, and be sure to tune in at the NBC6 News starting at 6 o'clock.
University and Beanpot Tournament Hall of Famer Reagan Rust was the perfect substitute ringer for the Mighty Drunks out of Nashville.
Like, I had no idea what I was getting myself into. I didn't even know any of the guys in this house until I got here. So when 2 weeks ago, I was like, yep, I'm doing it. I've been trying to do that more this year.
Yeah! Hey, Mars, let's go, boys! Reagan, she's been, just slotted right in, played this for forever. Sick.
It's just a really special sport. You see around the state people rallying around other teams. It doesn't matter where you're from.